When Sarah Mitchell walked into the emergency room that night, her colleagues saw just another small-framed nurse in scrubs. They had no idea they were looking at a combat medic who had saved lives under enemy fire in Afghanistan, someone who could perform surgery with a pocket knife if necessary, and who had nerves of steel forged in the world's most dangerous war zones. In 12 hours, their assumptions would crumble, and Sarah would prove that sometimes the quietest person in the room is the most dangerous when lives are on the line. Sarah Mitchell pulled into the parking lot of St. Mary's General Hospital at exactly 6:45 p.m., 15 minutes before her night shift began. The October rain drummed against her windshield as she sat in her small Honda Civic, taking a moment to prepare herself for another 12-hour shift in the emergency department. At 28 years old, Sarah looked younger than her age, with shoulder-length brown hair usually tied back in a simple ponytail and kind hazel eyes that seemed to miss nothing. Most people meeting her for the first time assumed she was fresh out of nursing school, perhaps someone's daughter who had landed a job through connections. They couldn't have been more wrong. Sarah had spent the last 6 years serving as a combat medic in the U.S. Army, with 3 deployments to Afghanistan under her belt. She had treated gunshot wounds in the back of armored vehicles racing through hostile territory, performed emergency procedures in field hospitals while mortars exploded nearby, and saved countless lives in conditions that would break most people. The tiny scar above her left eyebrow came from shrapnel during an ambush outside Kandahar. The barely visible mark on her neck was from a piece of glass when their convoy hit an improvised explosive device. But none of her new colleagues knew any of this. When Sarah had started at St. Mary's 3 months ago, she had simply listed her medical training and certifications on her resume without elaborating on where and how she had gained her experience. She preferred it that way. Civilian life was supposed to be her fresh start, a chance to use her skills in a place where the biggest emergency might be a heart attack or a car accident, not a soldier bleeding out in a minefield. As she walked through the hospital's automatic doors, Sarah nodded to Jim, the security guard who was finishing his day shift. Jim was a former police officer in his 60s, with gray hair and a perpetual scowl that made most people keep their distance. He had taken a liking to Sarah from her first day, though he couldn't quite put his finger on why. "Evening, Sarah," Jim said, looking up from his crossword puzzle. "Looks like it's going to be a quiet night. Rain usually keeps the crazies inside." And Sarah smiled, a genuine expression that reached her eyes. That's what they always say right before everything goes sideways. Jim chuckled, but there was something in Sarah's tone that made him look at her more carefully. She spoke like someone who had seen enough chaos to know that calm moments were usually just the eye of the storm. The emergency department at St. Rosenhof Mary's was a typical mid-size hospital setup, 12 beds in the main area, separated by curtains that offered the illusion of privacy, 2 trauma bays for the most serious cases, and a small procedure room where minor surgeries could be performed. Tonight's skeleton crew consisted of Dr. Richard Hampton, the attending physician who had been working emergency medicine for 20 years, Dr. Lisa Chen, a second-year resident who was brilliant but still learning to handle pressure, 2 other nurses besides Sarah, and Jake Morrison, a paramedic who worked part-time at the hospital between ambulance shifts. Dr. Hampton was the kind of doctor who believed his medical degree gave him authority over everyone in the room, regardless of their experience or expertise. He was particularly dismissive of nurses, viewing them as glorified assistants whose job was to follow orders without question. At 52, he had grown comfortable in his routines and didn't like being challenged, especially by someone who looked like she should be serving coffee rather than administering medications.
"Mitchell." Dr.
Hampton called out as Sarah checked the assignment board. "You're on triage tonight. Try not to let every hypochondriac with a headache tie up our resources." Sarah nodded without comment, though she noticed Dr. Chen's slight wince at Hampton's tone. The young resident had learned to navigate her attending's moods, but she still felt uncomfortable with how he spoke to the nursing staff. The first few hours of Sarah's shift passed routinely. A construction worker came in with a nail through his hand, requiring nothing more complicated than a tetanus shot and some sutures. An elderly woman arrived by ambulance with chest pain that turned out to be severe heartburn. A college student stumbled in with alcohol poisoning, requiring monitoring and IV fluids until his friends could take him home. Each case was handled efficiently, with Sarah moving between patients like a choreographed dance. She had a way of making people feel calm even when they were panicking, a skill that came from years of treating wounded soldiers who were often more scared than hurt. Her touch was gentle but confident, and her voice carried an authority that made both patients and their families trust her immediately. Around 10 p.m., the first sign of trouble arrived, in the form of Marcus Thompson, a local drug dealer who had been stabbed in what appeared to be a territory dispute. Marcus was conscious but losing blood quickly from a wound in his abdomen. and he was accompanied by 3 of his associates who were making it clear they weren't planning to leave until their friend was treated.
We need to get him into trauma bay 1 immediately, Sarah said after her quick assessment, but Dr.
Hampton was busy with another patient and waved her off. He can wait in bed 4. It's probably just a superficial wound anyway. Sarah looked at Marcus, noting the pallor of his skin and the way he was guarding his abdomen. Her trained eye recognized the signs of internal bleeding, something that required immediate surgical intervention, not a bed in the general emergency area. But when she tried to explain this to Dr. Hampton, he cut her off. I've been doing this since before you were born, Mitchell. The patient goes where I say he goes.
Sarah bit her tongue and helped transport Marcus to bed 4. Though every instinct she had was screaming that this was a mistake, she started an IV and began monitoring his vital signs, watching as his blood pressure gradually dropped despite the fluids she was pushing.
She documented everything carefully, knowing that she might need to justify her actions later. Meanwhile, Marcus's friends were becoming increasingly agitated. They had been asked to wait in the family area, but they kept trying to push their way back into the treatment areas. Security had been called, but the hospital's weekend security staff consisted of 1 elderly guard who was clearly out of his depth when dealing with 3 angry men who looked like they had stepped out of a gangster movie. At 11:30 p.m., everything started falling apart at once. Marcus's condition deteriorated rapidly as his blood pressure plummeted and his heart rate spiked. Sarah immediately called for Dr. Hampton, but he was in the middle of suturing a patient's forehead and insisted the situation could wait. Dr. Chen tried to help, but her inexperience showed as she fumbled with the blood pressure cuff and struggled to get a second IV line started. At the same time, Marcus's friends had grown tired of waiting and pushed past the overwhelmed security guard into the treatment area. The leader, a man in his 30s with tattoos covering his arms and neck, grabbed Sarah by the shoulder as she was trying to stabilize Marcus. "What are you doing to him? He looks worse than when we brought him in." Sarah gently removed the man's hand from her shoulder. Her movements calm but firm. "Sir, I need you to step back so I can treat your friend. He needs surgery, and every minute we delay makes things worse. Don't tell me what to do, little girl. You look like you should be working at McDonald's, not playing nurse." The comment stung, but Sarah had heard worse. What concerned her more was Marcus's weakening pulse and the way his eyes were starting to lose focus. She had seen this too many times before, the look of someone slipping away while bureaucracy and ego got in the way of proper medical care. "Dr. Hampton," Sarah called out firmly, her voice carrying across the emergency room in a way that made everyone look up. "This patient needs immediate surgical intervention. His pressure is dropping and he's showing signs of shock." Dr. Hampton finally looked up from his suturing, irritated at being interrupted. "Mitchell, I told you he's stable for now. Stop being dramatic." That was when Sarah made the decision that would define the rest of her night. She looked directly at Dr. Sobos. Hampton, her hazel eyes suddenly as hard as steel, and said in a voice that brooked no argument, "With respect, doctor, you're wrong. This patient has internal bleeding, probably from a nick to the mesenteric artery. Based on the location and presentation of his wound, his blood pressure has dropped 20 points in the last 15 minutes. His pulse is thready, and his skin is becoming mottled. If we don't get him to surgery in the next 10 minutes, he's going to die." The emergency room went dead silent. Dr. Chen stopped what she was doing and stared at Sarah with wide eyes. Marcus's friends looked back and forth between Sarah and Dr. Hampton, sensing the tension but not understanding the medical terminology. Even the other patients seemed to pick up on the sudden change in atmosphere. Dr. Hampton's face flushed red with anger and embarrassment. He wasn't used to being challenged, especially not by a nurse who looked like she had barely graduated high school.
Nurse Mitchell, you will not diagnose patients in my emergency room.
"You will not countermand my orders, and you will certainly not speak to me with that tone." Sarah didn't back down. Instead, she reached over and lifted Marcus's shirt, exposing his abdomen. The skin around the wound site was becoming distended and discolored, classic signs of internal bleeding that were visible even to someone without medical training. "Look at him," Sarah said simply. "Really look at him. His body is telling you everything you need to know." Chen moved closer, her young face creased with concentration as she examined Marcus's abdomen. What she saw made her gasp softly. The signs were all there, exactly as Sarah had described. How had she missed them? How had Dr. Hampton missed them? "She's right," Dr. Chen whispered, though her voice was barely audible. She was caught between her medical training, which told her Sarah was absolutely correct, and her position as a resident, which required her to defer to her attending physician. "Dr. Conpen says his Hampton's jaw tightened. He was trapped between his ego and his medical license, knowing that if he was wrong and a patient died, there would be consequences. But admitting that a nurse had made a diagnosis he had missed would be a humiliation he wasn't prepared to accept.
The patient stays where he is. Dr. Batts?
Hampton said finally, his voice cold and final. And Nurse Mitchell, you can consider yourself written up for insubordination. That was when Marcus's friends decided they had heard enough medical jargon and wanted action. The leader, who had identified himself as Rico, stepped forward and grabbed Dr. Hampton by the front of his white coat. I don't care about your hospital politics, Rico snarled. My boy is dying and you two are standing here arguing about who's in charge. Fix him, or I'm going to start fixing both of you. The threat hung in the air like smoke, and suddenly the medical emergency had become something much more dangerous. The other two men moved to flank Dr. Hampton while Rico's grip tightened on the doctor's coat. The elderly security guard had retreated to call for backup, but everyone in the room knew that help wouldn't arrive in time to prevent whatever Rico was planning. Sarah assessed the situation with the same clinical detachment she had learned in combat zones. 3 armed men, though she hadn't seen weapons yet. 1 critically injured patient who would die without immediate intervention. 1 attending physician who was frozen with fear and wounded pride. 1 resident who was brilliant but inexperienced in crisis management. And herself, the underestimated nurse who was the only person in the room who had dealt with situations exactly like this one before. She made her choice. Rico, Sarah said, her voice cutting through the tension like a scalpel. The man turned to look at her, his eyes blazing with anger and desperation. I can save your friend, but I need you to let go of the doctor and step back. You're just a nurse. Sarah met his gaze without flinching. When she spoke again, her voice carried an authority that seemed to come from somewhere deep inside, a place forged by years of making life and death decisions under impossible pressure. I've treated gunshot wounds in combat zones while enemy fire was coming down around us. I've performed surgery in the back of moving vehicles. I've saved lives in conditions you can't even imagine. Your friend has internal bleeding, and if you want him to live through the next hour, you need to let me do my job. The emergency room was so quiet that the only sounds were Marcus's labored breathing and the steady beep of the heart monitor. Rico studied Sarah's face, looking for any sign of deception or weakness. What he saw instead was absolute confidence, and a calm determination that reminded him of soldiers he had known who had seen real combat. You can do that? You can save him?
Yes, Sarah said without hesitation.
But not if I have to worry about whether you're going to attack my colleagues while I'm working. I need you to trust me, and I need you to keep your people calm. Rico released Dr. Hampton and stepped back, though his posture remained tense and ready for action. You got 30 minutes. If Marcus dies, this whole hospital's going to have problems. Sarah nodded, accepting the terms of an agreement that could cost her career, or worse if she failed. She turned to Dr. Chen, who was staring at her with a mixture of admiration and terror. Lisa, I need you to call the OR and tell them we're coming up with an emergency abdominal surgery. Tell them it's a probable mesenteric artery injury with active internal bleeding. Then get blood bank on the line and have them cross-match 6 units of O negative. Chen hesitated, looking at Dr. Hampton for confirmation. The attending physician was still shaken from his encounter with Rico, his face pale and his hands trembling slightly. He opened his mouth as if to object, then seemed to realize that he was completely out of his depth. Do it, Doctor, Hampton whispered. Sarah was already moving, her hands flying over Marcus's body as she performed a more thorough assessment. His pulse was getting weaker, but it was still there. His blood pressure had stabilized temporarily, though she knew it wouldn't last long. She had seen dozens of similar injuries during her deployments, and she knew exactly what needed to be done. Rico, I need you to listen to me very carefully, Sarah said as she prepared Marcus for transport. Your friend is going to look worse before he looks better. The surgery might take several hours, and there's going to be a point where it seems like we're losing him. But if you trust me and let us work, he's going to make it. How do you know? How do you know? Sarah met his eyes again, and for just a moment, her professional mask slipped enough to show the steel underneath. Because I've never lost a patient who made it to surgery alive, and I'm not going to start tonight. As they prepared to move Marcus to the operating room, Sarah caught Dr. Hampton's arm. The older physician looked at her with a mixture of resentment and grudging respect, knowing that she had just saved him from a situation that could have ended his career, or worse. Doctor, I need you to know that I'm not trying to undermine your authority, but that man in there has friends who will hold us accountable for every decision we make tonight. We can't afford any mistakes. Dr. Hampton nodded slowly, some of the color returning to his face. What do you need from me? Call Dr. Rodriguez and get him down here. He's the best surgeon we have for abdominal trauma, and have pharmacy send up emergency blood products. We're going to need everything they've got." As Marcus was wheeled toward the elevators, Sarah couldn't help but think about how much her life had changed in the span of 30 minutes. 3 months ago, she had been just another new nurse trying to fit into a civilian medical environment.
Now, she was about to perform emergency surgery while 3 dangerous men waited in the hallway, ready to exact revenge if she failed. But as she scrubbed in for what would be the most important surgery of her civilian career, Sarah felt a familiar calm settling over her.
This was what she had been trained for, what she was good at. The setting might be different, but the core challenge was the same as it had always been. Save the life in front of you, no matter what else is happening around you. The clock on the operating room wall read 12:15 a.m. as Sarah made her first incision. She had no way of knowing that the next few hours would test every skill she had learned in 6 years of military service, or that by dawn, everyone at St. Mary's Hospital would know exactly who Sarah Mitchell really was. What she did know, with the absolute certainty that came from experience, was that Marcus Thompson was going to live through the night. She had made that promise to Rico, and Sarah Mitchell had never broken a promise when someone's life was on the line. The real test was just beginning. The operating room at St. Mary's Hospital had never felt more like a battlefield than it did at 12:30 a.m. on that October night. Sarah stood at the head of the table, her hands steady despite the fact that she was performing surgery under the most unusual circumstances of her career. Dr. Rodriguez, the hospital's chief of surgery, had arrived within minutes of being called, his gray hair disheveled and his eyes still heavy with sleep. What he found when he entered the OR was unlike anything he had encountered in 25 years of emergency surgery. "Talk to me, Mitchell, Dr. Seeker," Rodriguez said as he scrubbed in, his voice carrying the calm authority of someone who had performed thousands of operations. Unlike Dr. Asanov,
Hampton, Rodriguez had taken the time to review Sarah's file when she started at the hospital, and he knew enough about her background to respect her medical judgment. 29-year-old male, single stab wound to the abdomen approximately 4 inches below the left costal margin. Sarah reported as she maintained pressure on Marcus's bleeding vessels. "Based on the trajectory and presentation, I believe we're looking at a nick to the superior mesenteric artery. Patient has lost approximately 1,500 milliliters of blood. Blood pressure was dropping rapidly, but has stabilized since we got him on the table." Dr. Rodriguez nodded as he examined the surgical site.
Sarah had made the initial incision with textbook precision, exposing the abdominal cavity without causing additional trauma. Her hands moved with a confidence that spoke of extensive experience, and he noticed that she was using techniques more commonly seen in military field hospitals than civilian operating rooms.
"Where did you learn to operate like this?" Dr. Rodriguez asked as he took over the primary surgeon role, though he was clearly impressed with the work Sarah had already done. "Forward operating bases in Afghanistan," Sarah replied without looking up from her monitoring of Marcus's vital signs. "When you're dealing with blast injuries and gunshot wounds in conditions where the nearest trauma center is 8 hours away by helicopter, you learn to work with what you have and make every move count." As Dr. Rodriguez worked to repair the damaged artery, Sarah found herself falling back into the rhythm she had learned during her military deployments. In the field, there was no room for ego or hierarchy when someone was bleeding out on the table. Everyone had a job to do, and the only thing that mattered was keeping the patient alive. She monitored Marcus's blood pressure, adjusted his medications, and anticipated Dr. Rodriguez's needs before he asked for them. "Pressure's dropping again," Sarah announced as the monitor began beeping more urgently. "He's bleeding somewhere else." Dr. Rodriguez's hands stilled for a moment as he reassessed the surgical site. "There," he said, pointing to a small tear in the mesentery that had been hidden by clotted blood. "Must have been caused by the same blade. It's venous bleeding but significant." Without being asked, Sarah reached across the table with a clamp, isolating the bleeding vessel with movements so quick and precise that Dr.
Rodriguez barely saw them.
It was the kind of instinctive teamwork that usually took years to develop between surgical partners, but Sarah was reading the situation and responding as if she had been working with Dr.
Rodriguez for decades. Nice work, the surgeon murmured as he tied off the vessel. "Remind me to review your resume more carefully. I think we might have been underutilizing your skills." Outside the operating room, the situation was becoming increasingly tense. Rico and his 2 associates had taken up residence in the surgical waiting area, their presence making the hospital staff nervous and the few other families in the waiting room deeply uncomfortable. Hospital security had called in additional guards, but everyone was walking on eggshells, knowing that one wrong word or perceived slight could escalate the situation beyond control. Dr. Hampton had retreated to his office, ostensibly to complete paperwork, but mostly to avoid having to face Rico's intimidating stare.
The attending physician was struggling with what had happened in the emergency room, his professional pride warring with the growing realization that Sarah had probably saved not just Marcus's life, but possibly Dr. Hampton's career as well. If Marcus had died while receiving inadequate care, the resulting investigation would have revealed Dr. Hampton's poor judgment and potentially exposed the hospital to significant liability.
Dr. Chen, meanwhile, was discovering that the night's events had opened her eyes to aspects of emergency medicine that medical school had never taught her.
She found herself thinking about Sarah's calm competence under pressure and wondering how someone so young could have developed such advanced clinical skills. When she finally worked up the courage to ask Jim, the security guard, what he knew about the new nurse, his answer surprised her.
"There's something different about that one," Jim said, leaning back in his chair as he watched the hallway leading to the operating room. "I've been working security for 15 years, and you learn to read people.
Mitchell carries herself like someone who's seen action, if you know what I mean. The way she moves, the way she watches doorways and exits, the way she stays calm when everyone else is falling apart.
I'd bet money she's military. Doctor." Chen absorbed this information, thinking about how Sarah had diagnosed Marcus's condition with a single glance and had somehow convinced 3 dangerous men to trust her with their friend's life. The young resident was beginning to understand that there were different kinds of medical education and that some of the most valuable lessons couldn't be learned in a classroom.
Back in the operating room, Dr. Rodriguez was making the final repairs to Marcus's damaged vessels while Sarah monitored the patient's response to the surgery.
Marcus's vital signs had stabilized, his blood pressure was holding steady, and his color was slowly improving as the blood products they had administered did their work.
How did you know,
Doctor?
Rodriguez asked as he prepared to close the abdomen. About the mesenteric artery, I mean.
That's not typically something you diagnose from external signs alone. Sarah was quiet for a moment, her attention focused on adjusting Marcus's IV drip. When she finally answered, her voice carried a weight that spoke of experiences most people couldn't imagine.
In Afghanistan, we saw a lot of blast injuries and stab wounds from improvised weapons. After a while, you start to recognize patterns. The way someone holds their body, the color of their skin, the specific type of pain response.
This patient presented exactly like a soldier I treated outside Kandahar 2 years ago. Same wound trajectory, same symptoms, same rapid deterioration.
Did that soldier survive? He did. Went back to active duty 6 months later.
Sarah paused, checking Marcus's pupil response with a small flashlight. But that was only because we caught the bleeding in time and had a surgeon who knew what he was doing. Rodriguez smiled slightly as he placed the final sutures. "You know, Mitchell, when this is all over, we need to talk about your role here at the hospital.
I have a feeling we've been wasting your talents." As the surgery wrapped up and Marcus was moved to the intensive care unit, Sarah finally allowed herself to feel the exhaustion that came after hours of high-stress medical work.
It was nearly 4 a.m., and she had been running on adrenaline and caffeine since the beginning of her shift. But her work wasn't finished yet.
She still had to face Rico and his associates, who had been waiting for over 3 hours to learn whether their friend would survive.
Sarah found Rico pacing in the waiting area, his 2 companions flanking him like bodyguards. The larger man had removed his jacket, revealing a shoulder holster that contained what appeared to be a 9mm pistol. The hospital security guards had noticed but were keeping their distance, knowing that any attempt to disarm him would likely result in violence that could endanger innocent patients and staff. "How is he?" Rico demanded as soon as he saw Sarah approaching. His voice was hoarse from stress and too many cigarettes, and his eyes were bloodshot from lack of sleep and worry. "Marcus is stable," Sarah reported, her voice calm and professional. "Dr. Rodriguez was able to repair the damaged blood vessels, and we've replaced the blood he lost.
He's been moved to the intensive care unit where he'll be monitored closely for the next 24 hours. Rico's shoulders sagged with relief, and for the first time since arriving at the hospital, he looked less like a dangerous criminal and more like a scared friend who had been terrified of losing someone important to him.
"Can I see him?" "Not yet. He's still under anesthesia, and the ICU has strict visiting policies.
But I can take you to where you can see him through the window and I can give you updates throughout the night." As they walked toward the intensive care unit, Rico studied Sarah with the same intensity he had shown earlier, but now his expression was thoughtful rather than threatening.
You're not like the other nurses here. What do you mean? The way you handled everything tonight. Most people, they would have been scared, would have just done what that doctor told them to do even if they knew it was wrong.
But you stood up to him, stood up to me and my boys, and then you went in there and saved Marcus like you'd done it 1,000 times before. Sarah was quiet for a moment,
considering how much to reveal about her background. She had joined the civilian medical world partly to escape the constant reminders of her military service, but tonight had shown her that some experiences couldn't simply be left behind. "I have done it before," she said finally.
Different circumstances, same principle. Sometimes you have to make hard choices and trust your training, even when everyone around you thinks you're wrong. They reached the ICU, where Marcus lay connected to various monitors and IV lines, his chest rising and falling with the steady rhythm of someone who was going to survive. Rico pressed his hands against the glass window, his relief evident in every line of his body.
"I owe you," he said quietly. "Marcus is like a brother to me. We grew up together, been through everything together. If he had died tonight because of that doctor's stubbornness—" "He didn't die," Sarah said firmly. "And that's what matters. But Rico, I need you to understand something. What happened tonight can't happen again. You can't threaten hospital staff and expect good outcomes. People make mistakes when they're scared, and mistakes in a hospital can be fatal." Rico nodded slowly, understanding the wisdom in her words. "You got a point. But what were we supposed to do?"
That doctor wasn't listening, wasn't taking Marcus seriously. Sometimes you gotta make people pay attention.
Next time, ask for a patient advocate or another doctor's opinion. Hospitals have procedures for handling situations where patients or families disagree with treatment decisions.
Those procedures exist for a reason. As they stood watching Marcus sleep, Rico asked the question that Sarah had been expecting all night.
"So what's your story? You talk like someone who's been in situations like this before." Sarah was quiet for a long moment, weighing her response. Finally, she decided that Rico had earned the right to know who had saved his friend's life.
"I was an Army medic for 6 years. 3 tours in Afghanistan, mostly in forward operating bases where we dealt with combat casualties. I've treated everything from gunshot wounds to blast injuries to diseases you probably never heard of."
"When I came back to civilian life, I wanted something quieter, more routine. Turns out the skills transfer whether you want them to or not."
Rico whistled softly. "Army medic."
"That explains a lot. My cousin did 2 tours in Iraq as a corpsman with the Marines.
Came back different, calmer in some ways, but like he'd seen things that changed how he looked at everything."
It does change you, Sarah agreed. When you've held someone's life in your hands while explosions are going off around you, most civilian emergencies seem manageable by comparison. As dawn began to break outside the hospital windows, Sarah realized that her night was finally winding down.
Marcus's vital signs were stable. Rico and his friends had agreed to go home and return during normal visiting hours, and the emergency room was quiet for the first time in hours. But she also realized that something fundamental had changed during the night.
Word of what had happened was already spreading through the hospital. Nurses who had previously seen her as just another new hire were now looking at her with curiosity and respect.
Dr. Rodriguez had made it clear that he wanted to discuss expanding her responsibilities. Even Dr. Hampton had grudgingly acknowledged that her actions had prevented a potential disaster. More importantly, Sarah had discovered that she couldn't simply leave her military experience behind. The skills she had learned in combat zones weren't just medical techniques. They were ways of thinking, of assessing situations, of making decisions under pressure that could be applied in civilian settings.
Tonight had shown her that those skills were still needed, even in a place as supposedly safe as a hospital emergency room.